What is the Medicare supplement known as Plan F, and can anybody get it in 2024? My name is Christian Bruno. I'm a licensed insurance agent specializing in Medicare health plans. I own and operate a company called Christian Brindle Insurance Services, also known as Everything Senior Insurance, and we help individuals with their Medicare choices and navigating the maze of Medicare. And today we're going to be talking about Plan F and what is the truth when it comes to Plan F. Who can get it? Can anyone get it? Let's dive in. So Plan F came out in 1992. It was one of the first original Medigap plans that took place. Now, Medicare supplements have been in effect since Medicare became a thing in the 60s, but they were not always Medigaps. If you're not familiar, Medigap and Medicare supplement are, at this point in 2024, the same thing. They're two names for the same thing, tomato and tomato, okay? And in 1992, a first line of Medigap products, new Medicare supplement products at that point in time, dropped, and the Plan F was incredibly popular for many, many years. Over 20 years, the Plan F was among one of the, if not the most purchased Medicare supplement products in the country. If you're not familiar with what a Medicare supplement product is, a Medicare supplement product is designed to pay after Medicare as a secondary insurance. It's a policy, an insurance policy that is picked up through a private insurance company. And so Medicare pays first on your medical bills. Original Medicare covers things like medical bills, things like hospital stays, surgeries, doctor's appointments, durable medical equipment, home health care, skilled nursing, rehab, etc. But it does not cover 100% of these items. It leaves behind some deductibles, some copays, and in many cases, an unlimited 20% out of pocket. So seniors are left relatively exposed when they only have Medicare. So Medicare supplements have been around for decades and decades in order to be a secondary insurance and plug up the holes that Medicare leaves behind on the medical bills. And the Plan F did that as well as any Medicare supplement that's ever existed, okay? I always said that F stood for full coverage, okay? F stood for full coverage because everything that Medicare left behind on a medical bill, the Plan F would come behind it and pick it up as long as it was approved and covered by Medicare first as the primary. So the Plan F, as you can imagine, was extremely popular for many, many years. It was the only one that had full coverage, and seniors enjoyed, and folks on Medicare enjoyed, having this policy. Now, what ended up happening to the Plan F? Well, in 2020, a bill took effect that was known as the MACRA bill. The MACRA bill took two Medigap policies, Medicare supplement policies, the Plan F and the Plan C, which was very similar in coverage to the Plan F, but not nearly as popular, and it grandfathered them away for newly eligible to Medicare beneficiaries. What this means is if you were eligible for Medicare prior to 2020, you still will have the option of picking up a Plan F if you so choose to. If you become eligible after January 1st of 2020, the Plan F and the Plan C are off the table for you altogether, and they're not an option anymore. So that is the criteria. Prior to 2020, if you've been on Medicare or eligible for Medicare, you have the option of picking it up. If you're eligible for Medicare after 2020, then you do not have the option. Now, even if you're eligible for Medicare prior to 2020 and you wanted to pick up a Plan F, in most states, in most situations, there are some exceptions. You typically have to go through some health questions and some underwriting in order to purchase the Plan F. Now, if that is you and you're in a situation where you can pick up a Plan F and you can pass health questions and underwriting, the question remains, should you, if you're eligible for Medicare before 2020? My opinion was, leading up to when this MACRA bill took effect in 2020, the Plan F was starting to become a much inflated cost plan. Now, what I mean by this is the costs for it and the rate increases for it were starting to become higher and higher than other products. Now, the reason for this was twofold. One, the product line had been around since 1992, so there's so many people on it. Most notably, there is a demographic of individuals that have gotten on these plans years and years and years ago, and maybe they're an older demographic, they're starting to see more health problems, and the plan's paying out more claims. So anytime you have an older plan, that is typically what you see. In addition to that, Plan Fs also participated in what's known as guaranteed issue. Guaranteed issue is certain instances where you can pick up a Medicare supplement plan with no health questions if you're not turning 65, such as you're losing your employer coverage, you're on an insurance plan that just canceled, or maybe you have a Medicare Advantage plan that's dropping you because they're leaving the area, or something along those lines. Those were scenarios that people could pick up a Plan F with no health questions in this guaranteed issue situation. Not all Medigap and Medicare supplement policies have guaranteed issue rights. So the Plan F was taking in more people every year than they normally would who might have had a lot of health problems, and this was causing claims to go up. So because of this, we're starting to see the pricing for the Plan Fs become very high, and it just didn't ultimately make sense to pick them up anymore. If you look at the price difference in most areas on a Plan F versus a Plan G, usually the Plan G is substantially lower in a lot of instances than the Plan F, and the Plan N is even more so a reduced premium. So the Plan G and N are the two most popular Medicare supplement policies out there today. My office still recommends getting those, even if you have the option of picking up the Plan F, because usually math-wise, you come out ahead on one of those two policies, even if you have full coverage on the Plan F. Anyway, what do you think about this? Do you think the Plan F was a good plan? Do you think it is something you'd like to learn more about? Comment down below on this video. We'd love to have a dialogue with you about it. If this answered your question and you found this video educational and helpful, do us a favor, smash the like button for the YouTube algorithm. It's going to help so many more people just like you find this video who desperately need to see this information. We put out videos every single week answering commonly asked Medicare questions and bringing education to you so you can understand your Medicare options better. If you'd like to work with us on your Medicare plan, we have no cost for our services, no obligation of any kind. We are licensed in over 45 states. We'd love to be able to help you with one of our licensed associates. Our office number is 801-255-5340. Again, 801-255-5340. You can find that number also in the description if you're watching this on YouTube. Thanks so much for watching, everybody. Hope you found this educational, and we will see you next time. Happy Medicare, everybody.